Thank you for watching KTN News and welcome back. Now, as earlier promised, we are to get into a conversation with regard to health matters, but to be specific on reproductive health, especially on women. And in studio with me is Nancy Lynn Kavuka, reproductive health expert at Reproductive Health Network Kenya. As we have this discussion, welcome on set, and let's just go straight into this. Now, under this entire project that is there is something to talk about, Koni campaign with regard to reproductive health. Just what is this all about?
Thank you so much. So it is Chagum Koni. Chagum Koni is basically translated from, if I can translate it to English, is the choice in your hands, okay? So this is a campaign, the campaign that is led by Reproductive Health Network with partnership with the Ministry of Health, Clinton Health Access Initiative, and other partners in Kenya. And basically we are coming up to tell women, empowering them with information and the knowledge to help them make informed decision about family planning. In the Kenya Demographic Health Survey in 2022, it reported we have 14% unmet needs for family planning, okay? Though this is a decline from, slightly a decline from 2014, which was at 35%. So it means there's much that has been done, and such campaigns will actually come in to meet the unmet needs for the family planning in women in the country. So Chagum Koni has been launched. It was actually launched in February. It has trickled down to different counties to include Bungoma, Isiolo, and currently planning to also do it in Samburu, okay? And this will make women to be empowered, have their own choices in their hands, and get to meet the 14% that is reported by KDHS.
Yeah, now when you talk about Chagum Koni and having these decisions to be yours pretty much to speak, how did we bring up the conversation such that, say if it's in a marriage setting, how do we involve the man into this conversation? Because they would say, I am a stakeholder, I was not consulted. So as we push the Chagum Koni campaign, how do we rope in the men into this talk?
Thank you so much. So, of course, when we talk about family planning, we are talking about a family. What is a family without two people? In this case, a man and a woman. So for men involvement, we are talking about having men come up, having sensitization, having awareness to men, for them to actually support the women in uptaking family planning. When we have some chief barazas back in the counties, that men should also be there, get this information. When we are training the healthcare providers, when we are training the community healthcare providers in the counties, we are asking them, let the women be accompanied by the men. We can have some of the ways to really encourage men to come up with their women during the family planning services. Maybe have them line up. If you're coming with your husband, you have a leeway to have the first one to be given a family planning services. Just to encourage men, having these discussions, thanks to the media, rolling it out so that they get to hear and they get to be informed about family planning and support for their women too.
Now, the Chagum Koni campaign is there to fix a certain challenge or a problem or something that has been missing in the society. What are some of the challenges that are associated with accessing reproductive health?
Some of the challenges that are actually being faced in accessing this is accessibility to the facilities where a woman would actually go for this. So when we are bringing in Chagum Koni campaign, there are some of the family planning services that have been rolled out in countries like Uganda, and they have the power, the women have the power to actually walk to a facility, get this, we call it DMPA, subcutaneous, an injectable that a woman can actually inject themselves when they are properly trained on it back at home. So that way you nipping the gap of woman actually going miles and miles away to access the family planning in a healthcare facility. The other thing is about training, and we call it strengthening in capacity building. Already we have our healthcare providers, we have our community healthcare workers. So when we have training, we are empowering them with knowledge, we are empowering them with information to be able to access the services. And one of the things that came up with Chagum Koni is also a call center that Reproductive Health Network runs, and it's called Nena na Binti. Nena na Binti translated to talk to a lady or talk to a girl, okay? This space gives a safe haven, yeah? Where you have issues and fear of discrimination, by the way, is one of the things that makes people actually don't walk into a health facility for information. So it's a call toll-free number. You're able to call, you're able to air your concerns about family planning. Then you're sorted, you're guided, you're referred to providers. And one of the things that Reproductive Health Network, as far as it's in Nairobi, it has a network of over 500 providers across the country. And so with Nena na Binti, wherever you are, whether you're in Marsabit or Samburu, you call and we actually connect you to a provider, and you can able to link to the provider and get sorted about your issues to do with family planning. Yes.
Now, when we talk about reproductive systems, and pretty much just access to healthcare, we realize that the conversation around sex and all these issues are for a very long time have been a taboo not to be spoken in our societies.
Oh, yes.
Where now for us to be able to even have a toll-free, a Nena na Binti, is because there is the need to bridge that gap.
Oh, yes,
so how
true.
important is it for their society to be desensitized on these issues, for them to be able to accept the new technologies that are coming in, the information that is there with regard to reproductive health?
So for one of the strategic plans that Reproductive Health Network has is issues to do with service delivery, advocacy, okay? And we term to it with advocacy is actually helping a very vulnerable, a very someone who can actually speak for themselves out. So when we have campaigns to do with Chagum Kononi, when we have initiatives to do with Nena na Binti, it's actually to bring out the girl, to bring out the lady, to bring out someone who's not able to voice out their concerns, yeah? And so for Nena na Binti, once you get to speak out about your reproductive health issues, then you get to be sorted. And what the leading list of what discussions undergoes through Nena na Binti is everything to do with sex. For so long in this African setup, we've not been discussing sex. You bring it up at the table in a family setup and you looked at, is that discussion for here, yeah? But it's a high time. We've been checking statistics to do the other day with the Red Card campaign, yeah? Where it was reported high number of teenage pregnancies. So it's a high time we speak about sex. We have the Ministry of Health, Ministry of Education rolling out such subjects into the curriculum so that it is well versed with our growing adolescents and youth, and with the lifetime. Actually, it solves the issues with maternal mortality and cases to do with that. Yes.
Now, as we talk about societies and breaking down the stereotypes that do exist, how about we now talk about the myths and misconceptions around fertility products and alleged infertility that are caused by using reproductive health, pretty much accessing it?
And I'll say the Bible also brings it out that lack of information will actually make people perish, yeah? And we don't demean our African society, but there's some things we need to outgrow, yeah? There's some taboos that actually will not, it's called social stigma, that when a woman is seen walking into a healthcare facility for family planning, they're actually isolated, yeah? And some religions support it, that you do not have to go for family planning. But at the end of the day, you have this mother, they have just delivered. Within even 6 months, they already are pregnant and expecting another baby. So it means the health of this mother is already at risk. They are yet to give full attention to the growing child. Their body is already through stress with hormones and everything. And now here you're again pregnant, expecting another baby. Your body definitely will have to suffer the consequences of this. So with much information, sensitization, especially to bridge the cultural practices down in the bundos, yeah, for them to actually understand why is it helpful for this family planning. We are alleviating poverty at the end of the day. We are increasing the education for people and girls and boys and women in the society at the end of the day. So with the cultural taboos, and there's so much to do with westernization from the global north, yeah? So having the right information is very key. And this right information through the help of the leaders, church leaders, religious leaders in all angles to come in and actually have this message to the community.
And that includes having discussions around contraceptive use and the information out there that it leads to infertility. I mean, it is all about debunking the
Yeah. And once you get to see your healthcare provider, then they will sit down, do a sort of analysis of your blood parameters to say, so that you're given the right method. What works for a different woman won't work for all women in a setup, for example. They have many women with comorbids, yeah? You need to have your healthcare provider sit you down and tell you which is the best family planning method. Otherwise, you get to hear myths that someone had a coil and they conceived. It's true, it's out there. But for you, as a person, have you been taken through this the right way? How long should you come for a particular method, for example? In that if you miss a day, then you'll become pregnant. And one woman gets pregnant because of some misinformation about her family planning, then the whole society has a negative perspective about the family planning
I want
method.
to throw something in the works now. We know that technology is being developed and there are contraceptives that are being developed for men. Do you think men are up for that? Or it's wait and see?
It will be so nice to have men. So far, we only have condoms that is really much aware and out here, and people know that. Then we have traditional methods where men actually get to do it for them to avoid impregnating a woman, for example. You're being told about abstinence, you're being told about what we call withdrawal, yeah? And these are in the context of reproductive health, okay? So when we have ways and pills that are out here and they're yet to be certified by the Kenya Bureau of Standards and the Ministry of Health. So as for now, we will stick to what we know. And one of the things is encouraging men, yeah? When you have a husband, when you have a partner and you're talking or you're letting them through the journey of family planning, the involvement is 100% more effective than having them succumb to a particular method that they don't know anything about it.
So Chagum Koni has been there for, say, a while now. And just what are some of the successes that you have with it?
For the success of Chagum Koni so far is, I've told you we've launched it with call center. We have, since then we've received about 40% increase of calls than before. And this means we're actually lending an ear to a woman out there. And this information was not there before as of now. But since we launched this Chagum Koni campaign, the information now is there. They get to hear. The much training we've done so far in the counties and rolled it out in partnership with the Ministry of Health, of course. And they've got to roll it out to their senates in the counties, okay? And they are much aware about Chagum Koni campaign. And one of the things that was rolled out that is in line with Chagum Koni campaign is the subcutaneous injectable I was talking about. So women are being encouraged that they can be able to actually have this injectable, set it and put it in the safe of their home, because you can store it in the room temperature and you have these exact dates where you need to inject yourself. And by that, you're also curbing the needs for people to travel all far away for that particular method. Yes.
And when you talk about injectables, it is easier for when you're addressing the issue to do with distance covered access to healthcare, but what if someone has the phobia for needles? How do we then go around that? Because the access could be an issue, but what now is the alternative?
There are so many family planning methods. Yeah, there's so many family planning methods, and for such who have access to a facility is an issue. They have issues to do with injectables, for example. We have other methods like we call it coil, hormonal intrauterine device that is placed in the uterus of a woman, stays up to 12 years. They go up to 5, 10, depending on your planning, you know, and of course your husband involvement or your partner involvement in this. So there are some other ways we don't necessarily mean. So for what this injectable that has been launched in the safe care guidelines, WHO has also rolled it out in many countries in the continent. Yeah. So, and this ways to reduce any gaps we believe are coming to hinder the access to family planning. Yes.
Nenana Binti, Chagum, Koni, what is the interlinkage? How do they come together in championing this information?
So Chagum Kononi, you're telling the women you have the choice in your hands, okay? You can visit a healthcare facility. You can have this information anywhere, anytime. Where are you getting this information? Nenana Binti. So Nenana Binti, we have a counselor, we have medics, we have professionals who actually listen to when you call in with anything regarding your reproductive health issues, even to include sexual gender-based violence, So Nenana Binti comes in to cushion this choice in your hands. Now you have the choice. What are you going to do with this choice? You have the information through Nenana Binti, who can actually take you through on the best method that you want to do. Yes.
Nenana Binti, I think we should also have a discussion around Nenana Kijana, because I think it's a conversation
it is.
that it includes them as well. But now, moving forward now, with all this information out there, we know there is a lot more that needs to be done. The government is part of it, other stakeholders, the media, we are in it. So how do we make sure that this information goes across board in schools? How do we get these to, right now kids are at home, and there's always that fear that when children are at home, that is when they get to engage into early sex that end up into early pregnancies. Therefore, during this period, how do we just talk to the parents to make sure this message gets to their kids, to also make sure that women who don't have this information get to have them? And if I want to refer someone to you, how do I get to you?
Nice. So one of the things we like to echo is this information is available, but the trigger and the catch is, do you know that this information is out here, okay? As I said, thumbs up to media. In all angles, the radio stations, the vernacular, the TV stations, having this information to get to parents. We as RHNK have social platforms, the Instagram, where we get Facebook, and there's a cohort you get to attract in certain platforms, So having the right information rolled out in specific social platforms will actually give information to the parents, to the caregivers, to the guardians, so that they know how to talk through the kids. Having religious leaders play part of this, meeting them and discussing such issues. Also, they tend to roll it down to the kids. For example, in the Sunday school, we have the youth access programs in churches, for example, and having a stranger talk to them about this, having collaboration with some other partners who deal with adolescent initiatives that pregnancies to do, teenage pregnancies, there's some foundation out here, and having them have real-time experience from people who've gone through it will actually help them have this information.
That is Nancy Lynn Kavuka, reproductive health expert at Reproductive Health Network Kenya as she gives us her tidbits on how this information can get to everybody across board, because it is a conversation that involves all of us. It is a conversation that definitely must continue, and as Standard Media Group, we will continue to champion that. Many thanks for watching News Center. My name is Dennis Aseto. Enjoy the rest of your viewing. Good morning.